Welcome back to my channel. If you're new here, my name is Neil Galvin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students like you and nursing professionals with their studies. If that's something that you are interested in, consider subscribing. If you are already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos Mondays, Wednesdays, and Fridays. Please make sure to subscribe now. Hit that notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, you guys, let's jump into the video. Hi everybody, how are you guys doing? Yes, today is Monday and I know that this video upload is a little bit late for today, but hey, I am back on track. Yes, how are you guys doing? I just want to say hi to all new subscribers. We're really moving towards our goal for this month, which is 20,000 subscribers, 20,000 students, online nursing students on this channel. Now, I want to appreciate all of you. I want to thank you all for all your love and support, all your dedication and commitment to the channel. Maraming salamat po from the bottom of my heart. You guys are so amazing. Ngayon, I would just like to give you an update about the current status of our channel, just so you know that I actually kind of like be into the statistics of the channel. Now, let me share to you the news. Now, the watch time for this channel from the last 28 days, all of you guys who watch my videos are like 56.2% of you guys who watch the channel are not subscribed. That means 43.8% of you who's watching my channel are subscribers. So that left me with a higher percentage of numbers of watchers who doesn't subscribe to my channel, and I don't understand why. If you are seeing the benefit from my contents, if you are getting knowledge and these contents that I'm doing on my channel is helping you, give me a subscribe now and hit the notification bell, because as the channel grows and the subscriber counts grows, that means more opportunities and more the bigger the contents, the better the quality of the contents could get. You know what I mean? So I highly suggest for you to spread out the news about my channel. If you're watching right now and you haven't subscribed and hit that notification bell, let me give you time to do that, and it starts right now. Easy, right? That's like, it doesn't give you like 5 seconds to actually hit the subscribe button and that notification bell so that you'll be the very first one to watch my uploads. Now, like you see on the screen and on the title, this is all about nursing test banking. I created a lot of videos regarding nursing test banking. A lot of those questions came up to the recent board exam in the Philippines. If you haven't watched that and you're an upcoming test takers for the year 2023, I highly suggest for you to check that one out, because who knows, those questions might come up on the upcoming board. Now, this is about care of clients with physiologic and psychosocial alterations. This covers your Pnle 4. All right, so let's proceed. Let me share to you the objectives for our today's discussion. Every time that we're gonna have a nursing test banking, I want you to put in your mind that we only have 2 objectives. I am going to provide and discuss to you board exam type of questions, and I am going to provide rationalization per each board exam type of questions. If there's anything that I want you to take out from this nursing test banking for today's exam, that is going to be 2. One is the rationalization, because I want you to have a full grasp of the rationalization para pagdating ng araw ng board exam, no matter how they change the structure of the question, the multiple choices, you know exactly why that is the right answer. You know how to spot it, because you know by heart the reason why that is the right answer. And 2, I want you to take note of how I approach and attack certain questions test taking strategies. That's what I'm teaching you here. All right, and I also encourage you to please put in your scores on the not description box but comment section below, because I really want to evaluate the scores of my students. All right, so let's start the exam by giving you the instructions for our today's board exam. All right. All right, you will be given 10 board exam type of questions. I'll be reading the questions and the choices for you. You have 5 seconds to answer each question. The answer is revealed instantly after each question with rationalization. Choose the letter of the correct answer. Good luck, nurses. Now I want you to sit on a chair, grab a piece of paper and a pen or a pencil, and think about it this way. Let's say that this is the last 10 questions in the board exam. How well you want yourself to perform. These questions may come up in the upcoming board exam, I'm telling you. So, how well you want to perform these 10 questions. This could make or break your scores or your destiny in the board exam, the result of the board exam for you. So good luck. Let's start with board exam type of question number 1. All right. Marco falls off his bicycle and injures his ankle. Which of the following action should the initial response to the injury in the extrinsic pathway? Okay, let's dissect this question. Ang kaso mo, fall, right? Fall off on his bicycle. Ang tanong, initial response to the injury in the extrinsic pathway. That is the question. Is it A, release of calcium? Is it B, release of tissue, thromboplastin? Is it C, conversion of factors 7 to factors 7 alpha? D, conversion of factor 8 to factor 8 alpha. Your 5 seconds starts now. Time is up, you guys. What is your answer? Very good. Letter B. Release of tissue, thromboplastin. Let me give you the rationalization. Now, tissue thromboplastin is released when damaged tissue comes into contact with clotting factors. Calcium is released to assist the conversion of factor 10 to factor 10 alpha. Conversion of factors 7 to 7 alpha and 8 to 8 alpha are part of the intrinsic pathway. Hence, the answer is letter B. Malinaw ba yon? Malinaw. Let's proceed. Question number 2. Instructions for a client with systemic lupus erythematosus, SLE lupus, would include information about which of the following blood dyscrasias. Here's the question. Sa mga pasyenteng may autoimmune disease na diagnosed with lupus, SLE, anong blood dyscrasia ang inaasahan mo? What would you expect in terms of disorders that belongs to the category of blood dyscrasias? That's the question. Is it A, Dresser syndrome? Is it B, polycythemia? Is it C, essential thrombocytopenia? Or D, von Willebrand's disease? Your 5 seconds starts now. Time is up, you guys. What is the answer? The answer to this is very good. Letter C, essential thrombocytopenia. Here's why. Essential thrombocytopenia is linked to immunological disorders such as SLE and human immunodeficiency vitus. The disorder known as von Willebrand's disease is a type of hemophilia and isn't linked to SLE. Moderate to severe anemia is associated with SLE, not polycythemia. Dressler syndrome is pericarditis that occurs after myocardial infarction and isn't linked to SLE. Hence, the answer is letter C. Let's proceed. Board exam type of question number 3. The nurse is aware that the following symptoms is most commonly an early indication of stage 1 Hodgkin's disease. Here's the question. Symptoms of stage 1 Hodgkin's disease. Early indication. Early sign. That's how you're gonna approach this kind of questions. Very direct questions. Early sign of Hodgkin's disease. Is it A, pericarditis? Is it B, night sweat? Is it C, splenomegaly? D, persistent hypothermia? Your 5 seconds starts now. Time is up, you guys. Time is up. What is the answer to this question? The answer is letter B, night sweats. Very general po. Kasi yung night sweat, you can actually see that also in TB, tuberculosis, pulmonary tuberculosis. A lot of infection-based disorders can manifest as night sweats. May mga early manifestations yan. Here's why. Night sweats is the right answer because in stage 1, symptoms include a single enlarged lymph node, usually unexplained fever, night sweats, malaise, and generalized pruritus. Although splenomegaly may be present in some clients, night sweats are generally more prevalent. This is based on study, you guys. Pericarditis isn't associated with Hodgkin's disease, nor is hypothermia. Moreover, splenomegaly and pericarditis aren't symptoms. Persistent hypothermia is associated with Hodgkin's but isn't an early sign of the disease. Malinaw ba yon? Crystal clear? Crystal. Let's proceed. Question number 4. Francis with leukemia has neutropenia. Taray, di ba? Parang ano lang, tongue twister. So si Francis daw, he has leukemia. He's diagnosed with leukemia and he also have neutropenia. Which of the following functions must frequently assessed? In regards to neutropenia and leukemia, what were you assessed frequently? That is the question. Is it A, blood pressure? Is it B, bowel sounds? Is it C, heart sounds? Or D, breath sounds? Your 5 seconds starts now. Nursing assessment, you guys. Time is up. Time is up. Very good. What is the answer? Letter D. O, diba? Breath sounds. Here's why. Pneumonia, both viral and fungal, is a common cause of death in clients with neutropenia, meaning decreased level of neutrophils in blood. WBC, one of the, WBC differentials. All right. So frequent assessment of respiratory rate and breath sounds is required. Although assessing blood pressure, bowel sounds, and heart sounds is important, it won't help detect pneumonia. Infection kasi ang lalabanan mo sa leukemia and neutropenia. Mababa ang neutrophils, meaning mababa ang, defense mechanism, ang immunity ng taong ito. Between these two, most common kinamamatay nila is infection. Right? Cross-infection. So, you would what? Watch out for the lungs for signs of pneumonia, which is very common infection. Malinaw ba yon? Malinaw. Kumusta ang mga scores nyo? Mabilis masyado tong discussion natin. Are you liking it? Kung masyado mabilis, huwag kayo mag-alala. You can pause the video and think about it. Just for the purposes of this video, I'm just making it 5 seconds. Also to train your mind how to spot on certain questions directly and answer the questions as quickly as possible. Because in the board, trust me on this, time is your best friend. Time is very precious. It's precious as gold. Yes, diba? Okay, question number 5. The nurse knows that neurologic complications of multiple myeloma, tatlo, usually involve which of the following body system? Talking about the concept of multiple myeloma, alin daw dito ang may kinalaman sa naglilink sa neurologic complications? Neurologic complication sa mga pasyenteng diagnosed with multiple myeloma. Is it A, brain? Is it B, muscle spasm? Is it C, renal dysfunction? Or D, myocardial irritability? Your 5 seconds starts now. Time is up, you guys. Very good. The answer is letter B, muscle spasm. Ha? Why muscle spasm? Medyo tricky itong question na to because it's kind of like tricking you with the neurologic. Automatically, you will think about the brain, right? No. The answer is letter B, muscle spasm. Here's why. Back pain or paresthesia in the lower extremities may indicate impending spinal cord compression from a spinal tumor. This should be recognized and treated promptly, as progression of the tumor may result in paraplegia. The other options, which reflect parts of the nervous system, aren't usually affected by multiple myeloma. Bukol, right? Myeloma. Benign or malignant tumors. Malignant mostly because it's myeloma. All right? So impending paresthesia, muscle spasm, that's it. That's one of the sign of what? May impending impending, may nag-iimpede doon sa pathway ng electrical impulse from the brain to the other parts of the body, specifically doon sa area na may muscle spasm. Watch out for that. Now, before I reveal the 6 questions, baka naman hindi ka pa nagsasubscribe, nakakahiya naman sa'yo. Go! Go. Diba? Ang bilis lang. Mag-proceed na tayo. Board exam type of question number 6. Nurse Patricia is aware that the average length of time from human immunodeficiency virus HIV infection to the development of acquired immunodeficiency syndrome, AIDS, is... Ito ang tanong, kung nalito ka, gaano kabilis magde-develop ang HIV to AIDS? Time frame. Length of time. That's the question. Is it A, less than 5 years? Is it B, 5 to 7 years? C, 10 years? Or D, more than 10 years? 5 seconds starts now. Time is up. What is the answer? Very good. Sa mga nakatama dito, 10 years is the right answer. Letter C. Epidemiologic studies shows the average time from initial contact with HIV to the development of AIDS is 10 years. O diba ang haba ng incubation period niya? Kaya nga, required na laging nagpapacheck. Yung mga sexually active dyan, kailangan lagi tayo nagpapacheck. Okay, libre man yun. O kayo dyang diba? Eto na tayo, board exam type question number 7. An 18-year-old male client admitted with heat stroke begins to show signs of disseminated intravascular coagulation, DIC. Which of the following laboratory findings is most consistent with DIC? Tinatanong ka, laboratory serum blood that is most consistent to DIC. Meaning, to rule out DIC, anong laboratory findings ang hahanapin mo? That's the question. Is it A, low platelet count? Is it B, elevated fibrinogen levels? Is it C, low levels of fibrin degradation products? Or D, reduced prothrombin time, PT? Your 5 seconds starts now. Time is up, you guys. What is the answer? Very good. Low platelet counts. Why? In DIC, platelets and clotting factors are consumed, resulting in microthrombi and excessive bleeding. As clots form, fibrinogen levels decrease and prothrombin time increases. Fibrin degeneration products increases as fibrinolysis takes place. That is the reason why the answer is letter A. Let's proceed. Question number 8. Mario comes to the clinic complaining of fever, drenching night sweats, and unexplained weight loss over the past 3 months. Taray, di ba? Binigyan ka ng background. Physical examination reveals a single enlarged supraclavicular lymph node. Inassess mo, nakakita daw ng enlarged lymph node saan? Sa supraventricular area. Which of the following is the most probable diagnosis? Binihingian ka. Probable diagnosis based on the enlarged subclavicular lymph nodes and sa symptoms niya. Fever, drenching night sweats, and unexplained weight loss for the past 3 months. Here's the choices. Influenza. B, sickle cell anemia. D, leukemia. D, Hodgkin's disease. Your 5 seconds starts now. Time is up. Time is up. What is the answer? Very good. The answer is letter D, Hodgkin's disease. Hodgkin's disease typically, C? Or sorry, D. Did I say C? Letter D po, Hodgkin's disease. Hodgkin's disease typically causes fever, night sweats, weight loss, and lymph node enlargement. Influenza doesn't last for months. Clients with sickle cell anemia manifest signs and symptoms of chronic anemia with pallor of the mucous membrane, fatigue, and decreased tolerance for exercise. They don't show fever, night sweats, weight loss, or lymph node enlargement. Unless there's infection, there will be fever. Leukemia doesn't cause lymph node enlargement. The answer is Hodgkin's. Malinaw yon? Malinaw. Question number 9. A male client with gunshot wound requires an emergency blood transfusion. Anong kaso? Gunshot wound, kailangan ng BT, blood transfusion. His blood type is AB negative. Which blood type would be the safest for him to receive? For blood transfusion ng pasyente mo, ang recipient is AB negative. Tinatanong ka, anong RH group ang pwede sa kanya? That is the question. Is it A, ABRH positive? Is it B, ARH positive? Is it C, ARH negative? Or D, ORH positive? Your 5 seconds starts now. Time is up, you guys. What is your answer? The answer is letter C, RH negative. Human blood can sometimes contain an inherited D antigen. Persons with the D antigen has RH positive blood type. Those lacking the antigen have RH negative blood. It's important that a person with RH negative blood receives RH negative blood. If RH positive blood is administered to an RH negative person, the recipient develops anti-RH agglutinins, and subsequent transfusions with RH positive blood may cause serious reactions with clumping and hemolysis of red blood cells. RH negative, RH negative. Kung may tanong ka dito, magtanong ka sa blood bank nyo. Gigigil ako sa'yo. But the answer is letter C. Now, we're moving towards the last question of today's examination. Before I reveal the question and the answer, baka naman di ka pa nagsusubscribe. Mag-subscribe ka na, go. Thank you so much. Love you. Eto na tayo. Board exam type of question. Number 10. Make this one count. Ito, I'm gonna give you a situation, ha? Stacy is diagnosed with acute lymphoid leukemia, ALL, and beginning chemotherapy. That is the situation. Now, here's the question. Stacy is discharged from the hospital following her chemotherapy treatments. Which statements of Stacy's mother indicate that she understands when she will contact the physician? Effectivity ng health teaching mo. Tinatanong ka, aling sa mga statement na to made by the mother will indicate that she understands when to contact the physician. When to contact the physician for referral for anything that is urgent or something like that. Is it A, I should contact the physician if Stacy has difficulty in sleeping? Is it B, I will call my doctor if Stacy has persistent vomiting and diarrhea? Is it C, my physician should be called if Stacy is irritable and unhappy? Is it D, should Stacy have continued hair loss? I need to call the doctor. Your 5 seconds starts now. Time is up, you guys. Excited na ba kayo malaman ng tamang sagot? Okay, eto na siya. The right answer is letter B. I will call my doctor if Stacy has persistent vomiting and diarrhea. Why? Persistent more than 24 hours. That's what I mean. Vomiting, anorexia, and diarrhea are signs of toxicity, and the patient should stop the medication and notify the healthcare provider. The other manifestations are expected side effects of chemotherapy, meaning ang hinahanap mo dito is adverse reaction. Letter B is the one that indicates adverse reaction. All right. Eto na tayo. Nako. Thank you so much you guys for watching. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics you want us to do. You comment it down below. Abangan mo nga yung upload natin this coming Wednesday, because it's going to be fun and amazing. I'm going to be uploading a nursing procedure video. It's going to be fun. It's about blood culture taking. So yeah, exciting to. I actually created, I just finished the calendar upload for my YouTube channel, and full pack and jam pack ang ating contents for this month of May. So, yun nga, maraming salamat po sa pag-antabay at sa pagsuporta sa channel. Tulungan nyo na nga ako, ipamalitan nyo na sa radyo sa ang pinakabago, pinaka-fresh at pinaka-libreng nursing reviews sa sa balat ng YouTube. And I'll see you again on Wednesday. You have a good one.